Well, hello everyone, and welcome once again to Ignite with Sandy, my weekly webinar where I interview wonderful women from all over the globe. And we are on what? The Celestia platform. And what is Celestia? Celestia is a platform for the empowerment of women. It's a platform where we discuss things which are related to work life balance. It's where we discuss health issues, where we discuss our dreams, our ambitions, and what we'd like to do with our life. And every week, I bring on a guest that is going to enrich your lives, is going to give you information that's going to bring about a positive difference. And this week, I'm going to bring on somebody from the medical field. Now, I'm one of those people who's quite conscious about health. I'm conscious about my diet and stuff like that because, when you're healthy, you can do so many more things. You can also be useful to your family, to your business, and to everything around you. So today, I'm going to be interviewing a lady, and I don't know when she started studying because she's so young. And yet, in this short period of time, she has developed so many things. She has done so much in her life. She has studied so much. She's done so much research. And today, she's going to share with us that wealth of information. And as you know, I never introduce my guest, I always get them to introduce themselves. And now, ladies and gentlemen, I'm bringing on my guest, Dr. Intissar. And of course, I'm not very good at all the technical stuff, so please do excuse all that nonsense that went on. And here we are with Dr. Intisar. So please introduce yourself, my dear, and tell us a little bit about your qualifications and educational background. Welcome to
Yeah.
Celestia.
Hi, Sandy. Thank you. I'm so glad to be here. Thanks for inviting me. Well, I'm a Moroccan nephrologist and professor of medicine at the Faculty of Medicine of Oujda, which is a city in Eastern Morocco. My medical fields of interest do include kidney disease, dialysis, organ donation, and transplant, and hypertension, of course. I am also actively involved in associative work, mainly in the support of kidney patients in Eastern Morocco. And I do have a passion for writing novels. In fact, my novels do showcase women's conditions and all the challenges they face in today's societies. My books are mainly in French, and most of them are being translated to English and Arabic. Last but not least, Sandy, I've recently published an academic book about social responsibility in health in Africa. That's
Okay,
it.
wonderful. So, Dr. Intisar, when I meet a lot of lady doctors, they're either gynecologists or endocrinologists, and you are a nephrologist. Now, many people don't know what nephrology is. So, will you please enlighten us?
Yes. So, as you said, nephrology is a specialty that deals with kidney disease and renal replacement therapy, which means dialysis and kidney transplants. I got interested in it very early as a young medical student, as it is a field where you can significantly improve the lives of your patients through life saving procedures such as dialysis and transplants. That's the main reason why I found it really, really interesting, inspiring, and useful. And as you know, it's very important for a person to feel relevant and useful. And of course, I got involved in research in this field because when you love what you do, you always want to seek more knowledge in that area. And being an academic doctor, it's part of my job to conduct and be part of research related to my area of expertise, of course.
Okay, so I think I shared with you the fact that I'm born with one kidney.
Hmm.
Right? And I have had absolutely no clue about this till much, much later in life when, for the first time, I had a scan. And
Yeah.
I then came to know about it. And what I was told is that I need to be careful, but other than that, everything's fine.
This is, I would not say a common condition, but many people do have. There are lots of people out there with one kidney, and of course, you can lead a healthy life. You are the proof of what I'm saying, uh, with a healthy lifestyle, of course.
Yes, I think that's the key word. But can you tell us a little bit about the connection between nephrology and hypertension? Because hypertension is something to do with the heart. Is that correct?
Well, not. I would not say it has to do just with the heart. In fact, all doctors should be able to treat hypertension, as this is something very, very frequent, and it is a major risk factor for morbidity and death. And kidneys, in fact, they play a crucial role in regulating blood pressure in our bodies. That's why kidney specialists, otherwise known as nephrologists, are also experts in the treatment of high blood pressure. And most kidney diseases are causes of hypertension, mostly severe and or complicated hypertension.
Okay, so what are the signs, or what do we need to look at, and how do we protect ourselves from this? What, like they say, prevention is better than cure. So, what
Yeah.
would you recommend?
We first should understand what is hypertension and why. And let me first thank you because you accepted to, or you rather invited me to talk about this interesting topic, because it's very interesting, because there are over 1 billion adults aged 30 to 79 years worldwide that do have hypertension, and most of them, I would say, two-thirds of them do live in low and middle income countries, and 32% of them are women, and they are unaware of this, that they have this condition. You know, that's only 40% of hypertension, of patients with hypertension are diagnosed and treated. And this is, as we've said in the beginning, a major cause of premature death worldwide. So first, the people who are listening to us should understand what is hypertension and what is blood pressure to start with. So blood pressure is the force or the pressure of blood pushing against the walls of your arteries. Arteries are the vessels that do carry blood from our heart to other parts of our body. So when the heart pumps blood through the arteries, the blood puts pressure on the artery walls, and this is blood pressure. And blood
Okay.
pressure normally rises and falls throughout the day based on our activities. So, what do blood pressure numbers mean? Blood pressure is measured using two numbers, as you know. The
Yes.
first number is called systolic blood pressure. It measures the pressure in the arteries when the heart beats. And the second
Okay.
number is called diastolic blood pressure. It measures the pressure in the arteries when the heart rests between the beats. So if the measurements read 120 systolic and 80 diastolic, you would say my blood pressure is 120 over 80. And
Okay.
a normal blood pressure level is usually less than 140 over 90 millimeter
Okay.
of mercury. Now we get to hypertension. So, of course, based on this, on what I've said, hypertension or high blood pressure is when blood pressure is consistently higher than normal, which means consistently 140 over 90 or higher. And
Okay.
I would like people who are listening to us to understand that the higher your blood pressure levels, the more risk you have for other health problems such as heart disease, heart attack, kidney injury, and stroke. Okay? You asked me about the causes, Sandy.
Yes.
So let me say that to develop hypertension, there are some genetic components and environmental components. And hypertension usually develops over time with aging, because as we age, our vessels tend to become stiffer. And stiff
Yes.
arteries, stiff vessels are linked to hypertension. This can happen also because of unhealthy lifestyle choices. There are, of course, some health conditions such as diabetes, obesity, kidney disease, that can also increase the risk of developing hypertension. But you know, in the matter of hypertension, we mostly, or we rather speak about risk factors, things
Yes.
that can increase our risk of getting high blood pressure. For example, you might be more at risk if you are overweight or obese, if you eat too much salt and do not eat enough fruit and vegetables. In fact, we should have a higher intake of sodium and a higher intake of potassium and a lower intake of sodium, less salt in our meals. And if we
Yeah,
don't
so
do enough exercise,
just to interrupt you there,
yes,
this is a point that is discussed all the time. How much salt, what kind of salt, and when you go to a supermarket, you have all the different kinds of salt. There's pink salt, rock salt, low in sodium, low in this, high in iodine, whatever else. So we are people who really don't know much about the science behind all of this. So how can we actually make a decision on having the salt that we actually need?
there is no problem about the type of salt or the brand of the salt, but about the quantity. Usually,
Okay.
it must not be huge quantities. When the person is at risk, or when the person is needs, for example, is under treatment for hypertension, we usually recommend 5 milligrams per day, not to exceed 5 milligrams per day. This is not much, but it's a healthy amount of salt that a person can take. We're going to see that in the part for prevention of hypertension.
Okay.
So let me go on with the causes. As I said, obesity and overweight, the food that is rich of salt, not enough exercise. When we drink too much alcohol or coffee or other caffeine-based drinks, people who smoking is also a risk factor of hypertension. A lot of stress. People who do live in stressful environments or who have stressful jobs, this is a recognized, currently this is recognized as a risk factor. There are also non-modifiable risk factors. For example, when you have a family history of high blood pressure, when your parents, your grandparents, or your relatives do have blood pressure, then you are really predisposed to that. You're prone to hypertension yourself. Ethnicity, when you're from Black origins, for example, Black people are more prone to hypertension, and they should be aware of that and check their levels of blood pressure and monitor them. There's aging, of course. When you're over 65, you should be very careful about that because, as I've said in the beginning, no, as I've said in the beginning, aging, this is a non-modifiable risk factors. The vessels become tougher and stiffer, and of course, this is linked to hypertension.
Okay. So when we are focusing on women, and
Yes.
women are going through the menopause, and obviously the estrogen levels are falling. Does that have any correlation with being more prone to hypertension?
Of course, but Sandy, not only menopause, women in all may present hypertension in all phases of their lives because, well, of course, there are risk factors and specific characteristics that do vary according to the age range, the ethnicity, whether the woman is Black or Caucasian, and the hormonal condition. In fact, the hormonal condition is very important when we speak about hypertension in women because in pregnancy, a woman can experience hypertension. A young woman who uses oral contraceptives can be exposed to hypertension. Women who have a hard time getting pregnant and benefits from assisted reproductive technologies are also prone to hypertension. And then, of course, menopausal women and women who use hormonal replacement therapies after menopause. All of these, as you see, I've almost cited all ranges of the life of a woman, from adulthood, young adulthood, to elderly women. So women should be aware of that, and there are lots of misconceptions because we tend to think that hypertension is a male condition, is a male problem, which is not true at all. And of course, acknowledging what we are sharing now, acknowledging these facts, might contribute to prevent and decrease, of course, hypertension-related adverse outcome in
Okay.
women.
Okay. So what I'm seeing from people around me, more and more younger people, younger women, are very stressed out.
Yes.
Emotional stress, financial stress, all kinds of like a bit lost, not knowing what to do, not being able to sleep well, binge eating, crash diets, you name it, everybody's doing it, right? What does this kind of yo-yo stuff that goes on emotions and diet, what effect will that have on our body and the blood pressure?
Of course, that's this chaotic lifestyle would have, of course, adverse repercussions on the lady's body and health. There's gain weight, and of course, not getting enough sleep, and not getting sleep of quality, and hypertension, and these ladies would be exposed to heart attacks, unluckily, and to kidney failure, kidney injury, strokes, maybe. So these are really, really terrible outcomes.
Yeah.
Yeah,
So,
women should be
okay,
aware.
yeah,
But
please carry on.
yeah, there is another thing, Sandy. Besides the chaotic lifestyle you elements you've cited, there is also a sexual life and a hormonal life that goes in parallel. These women might use contraception. These women during pregnancy, when you're stressed and you're living in terrible conditions, this does not make your pregnancy any easier. You are more exposed to hypertension during pregnancy. To there is a really dangerous condition that links hypertension and pregnancy, that is called preeclampsia. And you know, preeclampsia is I don't know, many people don't know about this dangerous condition, that is the sudden onset of hypertension and kidney damage with the
Okay.
presence of proteins in urine that happens in pregnancy. This is something that can be very dangerous for the mom and the child and the baby.
Okay, one question now. When you talk about, you've got you have elevated blood pressure or you're borderline hypertensive, and if you just change your lifestyle a little bit, everything will get okay. But once you have hypertension or what you call blood pressure, high blood pressure, can you actually get cured of that, or is it a condition that becomes lifelong?
Um, when you have when I mean when you have the onset, when hypertension is already there, and of course, if you stick to a healthy lifestyle, uh, it can be better. It can be controlled, because the goal of the treatment, the goal of medical care is to control blood pressure, and this is achievable. This is something that can be achieved, of course. And we usually target the achievements of the optimal blood pressure during the 3 first months after the first checkup, the first
Okay.
visit, medical visit. Of course, there are treatment, there are lifestyle guidelines, and there are drugs that we use. Okay,
Okay.
you want me
So
to? Yeah.
Okay, so I want you to explain in very clear terms, very layman's terms, to our audience that
Mhm.
when you are diagnosed with high blood pressure, what damage, if not controlled and monitored, whatever, what damage can it do to other organs in your body?
Yes. When blood pressure is not controlled, this can be very, very dangerous. It can go higher and higher and lead to what we call emergencies, hypertensive emergencies. When you have a very, very high blood pressure, it can lead to stroke, lead to very dangerous neurological conditions. Of course, it can lead to blindness. It can lead to heart attacks and congestive heart failure, and of course, it does destroy the kidneys. Okay, so these are mainly what we call the organ damage that is caused by the hypertension.
Okay, so here's a very dumb question. What is the difference between a heart attack and a stroke, or is it the same thing?
A stroke is a neurological damage. Okay, people can be paralyzed. They can have. They can. Get comatose, while a heart attack, it has to do with the heart. It's like a myocardial infarction. This is, it's very different. It has the second one has to do with the heart, while the first one has to do with the neurological state.
Yeah. But is it both connected to blood pressure?
Yes, yes, of course. Wherever there are vessels, they can be damaged by a high blood pressure. As I've said, is the blood pressure is the force that is applied on the vessels by the blood, and when it's very high, it damages all the vessels, and of course there are terrible complications related to that.
Okay, so when we're talking about the women, the females, and what would you recommend for a woman who is in her like late 20s, maybe married, wanting to have a baby, start a family, but she's also a working woman, so she's juggling her time. She's also ambitious, wants to go ahead, in her career, make a mark, stuff like that. So there are a lot of social pressures, family pressures, emotional pressures, etc. And so, in all of this, she generally forgets herself
Yeah.
because she's always looking out somewhere else. So, what advice would you give to the ladies between 25 and 35 about what they should be observing about their body and what should they be doing?
Let me first start but the medical advice, what they should be observing about their body as linked to our topic. First, they should be aware of this condition. They should know the signs about hypertension. Unluckily, usually there are no warning signs or symptoms, and many people, many young women, don't know what they have, because measuring blood pressure is the only way to know whether we have high blood pressure or not. Now, there are some signs sometimes when the blood pressure is very high, usually when it's around 180 over 120. People can experience symptoms including severe headaches, chest pain, dizziness, sometimes difficulty in breathing, vomiting, nausea. They can complain of a blurred vision or other vision changes. They can experience anxiety, confusion. They can hear some buzzing in the ears, get their nose bleed, and feel an abnormal heart rate. So, if someone is experiencing any of these symptoms and a high blood pressure, of course, they must seek care immediately. And they should know that the only way to detect high blood pressure is to have a health professional measure it. And they should also know that it's something really quick, not painful. And sometimes you have individuals who say, okay, I take care of myself, I check my blood pressure myself. I would like to say this is not enough. Of course, there
Yes.
are automated devices, but the assessment of by a health professional is important to assess the risk and the associated conditions I've talked about. So this is the first thing they should know. They should know to be able to prevent. And then, in order to prevent, there are some rules to lead
Okay.
a healthy lifestyle that I would like to share with
Yes,
the
please.
ladies who are listening to us. To prevent, of course, they should eat a healthy diet, choose healthy meals, make choices, healthy choices. Be sure to eat plenty of fresh fruits and vegetables. As I've said earlier, to get a higher intake of potassium, they should target fruits and vegetables and stay away from saturated fat, lower their salt consumption, stay away from big quantities of meat. because this is not healthy at all. And junk food, of course, avoid junk food as much as possible, as you know, for the reasons you know. Keep a healthy weight. Be physically active. Usually, we recommend patients or people to get at least 2 hours and 30 minutes a week of moderate intensity exercise, such as
Okay.
walking or biking every week. That's about 30 minutes a day, 5 days a week. I think this
That's
is
not
not
bad.
30 minutes a day, 5 days a week. Well, for younger adults and teenager, we recommend 1 hour daily. 1 hour is okay. Okay. But
Okay.
for older people, 30 minutes of walking or biking is enough. Do not smoke. This is a golden rule. Smoking
Okay.
is terrible for our vessels. It's terrible for our brain, for hearts, for the kidneys, for everything. There's nothing good about smoking, as all the listeners do know. Then limit how much alcohol you drink. This is again a rule and a guideline that is recognized by and delivered by most scientific societies currently. And get enough sleep, as we said. Get enough sleep, because getting enough sleep is important to the overall health. And enough sleep is part of keeping the heart and the blood vessels healthy. Not getting enough sleep, being stressed, and leading a stressful existence is linked to an increased risk of heart disease, high blood pressure, and of course, stroke. Okay,
Okay.
these
I
are the
wanted to just ask you about sleep because
yes.
this is an issue that comes up all the time, lack of sleep. I don't have enough time to sleep. I lie in bed and I just go to sleep for a few hours and then I'm awake. And then I start doing some other work, finish some work on my laptop, and then I try and get back to sleep. Or I get up in the morning, I'm exhausted, and I'm just waiting for a place where I can get some sleep. You hear this all the time. So, is there any way that we can improve our sleep pattern, do some things to make sure that we are actually getting uninterrupted sleep?
Well, to lead, as I've said, a healthy existence, and make healthy lifestyle choices, and get organized in your life. When you're organized, you have time for sport, you have time to exercise, you have time for work, for family, for friends, and you have time for sleep. Okay, not to remain awake long hours and go to bed at 3 a.m. and to plan 2 hours sleep because you got much work. This is really this is a terrible way to lead your life, and this is unhealthy, as you say. Now, if the person is dealing with some psychiatric conditions, with anxiety, with depression, of course, they should seek specialized help from specialists. Okay, but
Yeah.
getting enough sleep is crucial to be in a good shape and in a good health.
Yeah, you know what? When people talk about surviving on a little sleep, it is like a conversation piece. Oh, I just need X number of hours and I'm okay. I can operate with just 3 hours of sleep. Some, silly talk like that, and then it's like I have to meet deadlines. I have to do this. I'm working on a project. Blah blah blah. So I think what I'm hearing from you is that we need to make ourselves a priority in
Yes.
terms of how we take care of ourselves because unless we are okay, we can't do anything else. Is that correct?
Yes, of course, and especially when it gets to women, because most of the
Yes.
time women are very are they multitask. They have a lot of things to do, especially when they work. In our modern era, they have a lot of responsibilities. Kids, the family, the couple, the I don't know, the work, and so on. But they should get organized. When you're a lady and you want to live with a healthy shape, you should get organized and have time for yourself. And this way, when you're healthy, you can live your life to the fullest. You can fulfill your dreams, set goals, and try to achieve them, to get to them. This is how you can be happy, be at peace with yourself, and lead a healthy existence.
Yeah. The other thing that I'd like to touch on, Intisar, is the fact that nowadays you can, be very irresponsible and eat all the junk and, put on all this weight. And then, of course, you don't want to change your lifestyle or, indulge in exercising. I'm still using the word indulge, exercising and bringing about a change. What I'm seeing a lot now, and even a lot of ads, this, I'll just go to the doctor and I'll get something called gastric banding, or I'll swallow something and it will become a balloon in my stomach. And I won't be eating so much, so automatically I'll get thin, but I'll still continue to be irresponsible about my diet and my sleep. So these cosmetic ways, these fast ways of reducing weight and whatever else, what implication does that have on our heart and our blood pressure?
I cannot, I wouldn't like to judge anyone's choices, but you said a word that is very, very important. You said these are irresponsible uh, choices somehow, to go to choose to eat in a certain way, to binge, and to get involved in some very unhealthy, very dangerous lifestyle, and
Yes.
after that to seek cosmetic help and surgeries to reduce weight, and so on. Well, uh, it might bring these surgeries and these interventions might bring results for some people, but as any intervention, they might be risky for the heart, of course, for the overall health. So stay away. What I would like to tell or advise the ladies who are listening to us is to stay away from irresponsible and seeking easy ways to look beautiful. This is not something I would recommend at all.
Yeah. Okay, so talking about all your research and your work and everything, you are a very busy lady, but yet you have time to write books. So share with us about your books and how do you make the time to do that?
Uh, as I've said in the beginning, I'm a writer. I write novels, and my novels do speak about or tell about Moroccan women. They tell about the life and the challenge, the lives and challenges, and these are really heart touching stories about some very admirable ladies that are confronted to some harsh conditions, but yet they get to advance in lives with with absolute confidence, and they accomplish so much. So I've published so far four books about the same topic, mostly the lives of women in Moroccan families and so on. And they were really appreciated by the readers, and that encourages me to keep on writing and to keep on publishing. And now I'm really glad because my books are being translated to English and Arabic.
Oh,
So
okay.
they are going to reach even a wider I mean, it's going to
Audience.
broaden, yes, to broaden my horizons and to make me get to uh, many people around the world. And this is really interesting and encouraging at the same time.
Okay, so is this very therapeutic for you? Like when you're in that creative space, do you feel more relaxed, more energized? You can think very clearly, your level of enthusiasm is higher, and you are in a space of being very happy.
Yeah, writing is a therapy in itself. When I write a dialogue or when I come up with a character and I give life to this character, I make him or her interact with others and find solutions to various problems and succeed at the end. This is a terrific feeling. I feel just like I have some power over things, over facts, and over the events of life. And this is really something, yeah,
that you
this is,
enjoy.
yeah, of course, it's very joyful. You feel that you're contributing, and at the same time, you're transmitting messages, you are telling stories with very intense and deep messages and that make people that nourishes lots of debates and make people think and react, and some are against some of the messages, others thinks that the messages are very very relevant, so it makes people discuss, it draws attention to many conditions, social conditions that I like to shed the
Highlight.
light to
Yeah.
highlight, of
Okay.
course.
So tell me, Intissar, you have your medical, you have your research, you have your lectures, you have your books, and do you have kids?
Yeah, yes.
Oh,
I
okay. Tell us, how do you balance that?
Well, I don't know, but I think that organization has to do a lot of that. I'm really organized. There's time for my patients, time for my students, and time for writing. And of course, time for my kids. I have a grown-up son, and he's a teenager, in fact, and
No.
yes, and a younger child. But now I have time to write, and more than it used to be some years ago because my kids were younger. I didn't have the same amount of time as I do have now.
Yeah. So I think, where a lot of times when I speak to women, some of them are very overwhelmed by the fact that they have children. And they sort of sometimes use that as a bit of an excuse about not having time to do ABCD because
You
they've
know,
got something else.
I get, yeah, this is a wrong excuse. When you have a passion, when you want to do something and you like that thing, there is no excuse for not doing it. For example, if you love, I don't know, if you love dancing, if you love baking, I don't know, if you like drawing, you will find time for your passion. This is very important. For me, it's reading and writing. I love to read and I love to write and I love to share messages through the characters I come up with.
Yeah.
I do
Now, being,
construct.
being the, yeah, so being the mom and being the doctor,
Yeah.
what kind of diets, etc., do you recommend or encourage to the kind of foods to eat at home? And having a teenage son, how do you sometimes say to them, well, okay, you can indulge in a bit of this or that, but it's important to have the basics in place, like good, nutritious food.
Yeah, Sandy, with teenagers, sometimes it's really hard to implement, or I would say, the healthy lifestyle with the vegetables and fruits, and to stay away from the junk food. This is not easy, but I try. I try to be patient. I try to say the things over and over again, and to give the example. I don't take any junk food. So, and each and every time I see them, for example, I see my kids uh, eating something that is not healthy. I advise them, but how to say, calmly. Try not to get angry, and I explain, this is not good. This does not make you strong. This does not make you smart, and things like that. And I'm really patient about that. I say it again and again without feeling fed up. That's the key, I guess. That's the key. But it's not easy. Trust me, it's not easy with teenagers at all.
Quite true. I've been through that myself, and I found that when they have the freedom to go off to university, I think they've spent the first 6 months eating only junk food. It was like,
Yes,
all those years of frustration, and my mother didn't allow me to eat. Now let me just eat. And like they say at university, the kids, there's the 15 kilos that you put on in the first year because you're away from home, and you
this
can eat
is
and indulge in anything you want.
yeah,
Yes,
this
of
is
course,
quite
common sense stuff.
understandable. Hmm. We can easily understand that.
Yes, yes, absolutely. So, and so we're coming to the end of our webinar. And so, for all the women who are listening, I would like you to list just 5 points of what they can do to start with to get on the healthy path in their life.
Yes, but I have a message for the ladies who are listening to us. No matter your age, ladies, you can take steps each day to keep your health and your blood pressure in a healthy range. And whenever there's something wrong, just talk with your doctor about ways to manage your overall health. If you're diabetic, just to manage your diabetes and control other risk factors. And of course, get a healthy lifestyle. Do not eat much salt. Do not eat much fatty products. And exercise. Remain within a healthy range of weight. Do not smoke. Limit your alcohol intake, and just exercise, of course. This healthy lifestyle is the key to prevent hypertension and to control it if it's already there.
Okay, that's all on the exercising and the eating. What about the mental part?
About the mental part, be at peace with yourself.
Okay.
Try to grow, to find your passion, keep on learning, keep on advancing in life, keep remain with an open mind, and try to seek knowledge, and try to seek new challenges in life, and try to uh, not to be angry with what life might bring. Whenever there's something, take the listen, and as the Americans say, take time to smell the roses. Whenever
Okay.
you're advancing in life, take time to live every event to the fullest, and to take each lesson, and to try to understand it and get the best from it.
Okay, on that lovely note, I'm sure a lot of us will actually stay and smell the roses, stop and smell the roses. And if you're in Dubai and you don't have roses in the park or in the garden, we can always go to the florist shop and have such a variety of roses that we could smell just to make us feel good. So thank you very much, Intissar. And I hope we will be able to meet in person someday. And what you've shared with us is good common sense, something which is not complicated, too medically complicated for people to understand. You've been able to uh, point out things that we can implement immediately. So thank you very much.
Thank you, Sandy. I was so glad of this interview. Thank you.
Yes. God bless and thank you. Well, you heard it all. So it's not that complicated. And what are the takeaway points from today? Start enjoying your life. Start chilling. Start relaxing. More important, make sure that you're making healthy choices when you're choosing to eat. Yes, I know there's certain things that, the palate is always there. Oh, this wasn't tasty. That really is nice. My body requires this. I have a yearning for that. Yes, I'm guilty of that too, but I try and balance it out. And what the other thing that Intisar said is please try and be active. Active doesn't mean you have to start pumping iron in a gym. Active could be walking. And when I talk about walking, we're not talking about just strolling around in the house or strolling. We're talking about focused walking at a pace that if you start with a comfortable pace, but then you go better and better and higher and push yourself to do more. So, sleep, yes, my favorite thing. But yes, I know sleep is something what a lot of women struggle with, sleep deprivation. And believe you me, you're not doing yourself a favor. So, love yourself, look after yourself, Make yourself a priority, enjoy yourself, live life to the fullest, and you'll be here happy and healthy with Celestia Magazine and Ignite with Sandy. So, thank you very much for watching us today. And don't forget to watch us on YouTube, to like and to subscribe. We also have an amazing Instagram page. Please do like us on that. And on that happy note, goodbye and God bless.